Welcome, my name is Dr. Lucy of the Eye Clinic channel. In this channel we teach you about eye diseases and eye conditions and where you can get help. We also teach you some of the things you can do in the comfort of your home to alleviate some of these symptoms, because we are in the COVID-19 era, so you don't want to keep on moving up and down looking for some help.
So today let us discuss how to manage bags under the eyelids. These are common, especially with the increased screen time, especially in the recent past, and the aging. You should, however, not confuse bags under the eyelids with the black eye, which more often than not is due to trauma around the eyes. After that, we will mention some of the causes and then discuss how to get rid of them. So there are many causes of bags under the eyelids, but for this discussion, I'll mention three notable ones. And the first being lack of adequate sleep and fatigue. When we sleep, fluid settles beneath the tissues on our eyelids. When we did not get enough restorative sleep, the vessels of the eyelids tend to dilate or open up. This means that there is an increased volume of blood around your eyelids. Unfortunately, this flow is very sluggish. So because the skin of the eyelids is very thin, this appears like a darker tint compared to the rest of your facial skin. Secondly, when you do not sleep, the vessels under the eyelids leak fluids which is deposited in the tissues under the eyelids, making the problem even worse. The second cause of bags under the eyelids is aging. With aging, the eyelids become weakened and the skin loses its elasticity and sags. Secondly, with aging, the facial fat moves from up downwards because of gravity and is deposited under the eyelids, making the baggy appearance even worse. The final cause of bags under the eyelids is certain habits that we may want to get rid of with time or even immediately if we can. So one of the habits most of us have is adding salt to already salted food. The chemical in the salt is sodium. So what this does is that it retains fluid in our bodies. And if you're hypertensive, it can even make your blood pressure even worse. So apart from using too much salt in foods, other habits that make this condition worse is binging on alcohol, smoking, taking too much fluids at night, and sleeping with makeup. So how do we prevent bags under the eyelids? As we have discussed, certain habits need to be corrected. The best way to avoid bags under your eyes is to get enough sleep. You need to know when you need to take a break from your work and just take that crucial rest. As we are now working from home, it becomes increasingly difficult to delineate working and break times, but this must be consciously designated. To get enough sleep, start by setting a schedule of when to sleep and when to wake up. So you need to change certain habits in order to improve your sleep duration and pattern. You need to sleep at least 7 to 9 hours as an adult, and then more so for the children. Try to reduce smoking with the aim of stopping it completely if you can. Smoking has a whole lot of side effects, not just on the eyelids, but on the kidney, the heart, the lung, and even your blood vessels. The other habit to reduce is to cut off drinking alcohol, or at least to reduce alcohol taking, because alcohol dehydrates your skin and can make you toss and turn in bed, and so you do not get that restorative sleep. The other habit that we are so fond of is adding salt or eating very salty foods. The sodium in the salt retains a lot of fluids in our body and can sustain a high blood pressure. So if you can reduce salt in your food, you can hit two birds with one stone. You also need to reduce the amount of fluids you take before bedtime. Taking excess fluids before bedtime makes your kidneys work extra hard and can make you wake up in the middle of the night to go to the bathroom, and this can cut off your sleep duration and pattern. Remember, every time you wake up to go and do something else, falling asleep again becomes a problem, and therefore you cut on the duration of your sleep. For the ladies in the house, the habit to stop is really sleeping with makeup. The area under your eyes is weak and will wrinkle very fast under heavy makeup, causing bags to stand out even more. If you don't remove the makeup, it will irritate that skin and it will cause it to swell, making that baggy appearance very noticeable. You can also use makeup to mask that baggy appearance, but remember to always remove before you go to bed. If you find that you have bags under the eyelids, you can fix them quickly. Use a coat complex, and you can do this by using a wet cloth which you can cool down by putting it in the freezer compartment of your refrigerator for about 5 minutes, or maybe use an ice pack or frozen vegetables like a chilled cucumber. Then apply this for a few minutes on your eyelids while you're seated or lying in somewhere in bed with mild little pressure. What this does is that it reduces the swelling by decreasing the blood flow through your eyelids. And if there was a bit of inflammation, it also reduces that inflammation. The first medical treatment is to manage any known cause of bags under the eyelids, like treating allergy and sinusitis. I will put a link below on how to manage allergy and you can check it out. The other medical treatment is to improve eyelid skin tone and tighten the skin. This is an eyelid surgery by the name Blepharoplasty. What happens in this surgery is that the surgeon removes excess fat through an incision in the crease of the upper eyelid or inside the lower eyelid. This is really to make sure that there is no visible scar after the surgery.
So that concludes today's session on management of bags under your eyes. Do join us next week for another exciting session. Remember to subscribe so that you can alert you every time that we post our videos. And until next week, stay safe.